your information, everyone, and this webinar is going to be recorded with slideshow and all the voices we are talking to, including from the beginning, actually from now on. And we're going to share with this video around within 2 weeks, and we're going to share through our website, Jeisys medical website. That's our plan, and I'm going to share with this information again, but if you, during the presentation, if you have questions, please leave your message as a messages. So if you're using PC, and then it's easy to see questions section at your control panel, or if you're using with mobile device, and just send us message. And then we are, after the presentation, Dr. Winnie and Dr. Tan will collect that questions and going to review and answer for each questions after the presentation. And also, if you see the raise hand button, if you like this particularly with slide or some comments of our presenter, and just raise your hand, and it's going to be really good feedback for us. And after all this presentation, there is one more information for you, and we're going to launch a poll for next webinar titles or the subject. So please, before you leaving, please click what you want to hear through this webinar. And that will be really helpful for us for choosing our next subject, upcoming subject. So we have a minute now, a minute to go. I hope everyone can enjoy this webinar. So, thank you for joining, everyone. Welcome to the first Jeisys monthly webinar. 2 points for reminding you with this webinar. Number one, during this webinar, all attendees are able to leave your questions through questions section. If you are using PC, leave your questions through questions section at control panel, or if you are with mobile device, please send us via message. After the presentation, the speaker will review with these questions you have sent. Number two, during the presentation, if you like the specific contents presenter's comments or slide, please hit the raise hand button. This is for nice reward for presenter. The speaker for today is Dr. Winnie Tan from Indonesia. Hi, Dr. Tan.
Hi, Yumi. Hi, everyone.
Yeah, she is the director of Skin and Body Center Beauty Incorporation at Jakarta, Indonesia. She has been experienced for 4 years for this case, and she had done hundreds of gynecological cases. The title for today is Vaginal Rugosity Restoration through CO2 Laser Treatment. Now, Dr. Tan will give her presentation.
Thank you, Yumi. Yeah. Hi, everyone. And now I'm going to share about the treatment for the vaginal tightening. This is the efficacy of a novel laser treatment for vaginal tightening, which I use the CO2 laser. And because we treat about the vagina, so at the beginning I'm going to share about the 3 most cases that women suffer for. So the first one is the vaginal relaxation syndrome. This is a quite common medical condition that describes as a loss of the optimum vaginal structure and is usually associated with the vaginal child delivery and natural aging. Multiple pregnancies and deliveries contribute to a worsening of these VSR conditions, as well as the onset of menopause, which causes a decline in hormones levels and vaginal atrophy. Most women and their husband or partners refer this condition as loose vagina, which can cause decrease or loss of sexual gratifications. And the second is the vaginal atrophy. We know that this common thing happen in the most women that entering the premenopause, menopause, and also postmenopausal syndrome. And due to of the loss of estrogen productions, the genital tract is indeed particularly sensitive to a decline in estrogen levels. The clinical manifestation of vaginal atrophy generally occurs 4 to 5 years after the menopause, and up to 40% of postmenopausal women experience this vaginal atrophy that deeply affect sexual function and also the quality of their life. And only 25% of them seek medical assistance. So we can imagine how there are so many women that suffer for this condition and they need help. And the most common symptoms of this vaginal atrophy including dryness, dyspareunia, burning sensation, discharge, and pain. And this condition can occur both as a consequences of natural menopause and of induced menopause, which we can find in the cancer patient like breast cancer or endometrium cancer. They have to reach the menopause stage earlier than they should be. The decline in estrogen levels associated with menopause is closely linked to the reduction of blood flow and of vaginal secretion. Morphological alteration of the epithelium of the vaginal mucosa, decrease of the vaginal lactobacilli, and increase of the vaginal pH levels, which can lead to the some uncomfortable conditions for women. And we can see in this chart the dryness condition is increased significantly in the late perimenopause and postmenopause age. Now in the picture we can see the reduction of collagen in the connective tissue of the vaginal mucosa, whose function is to support the epithelium, causes the loss of the vaginal rugosity. We can see here on the difference on the left side compared to the right side. We can see the color in the right side, red, which means that it has a good blood supply and also lubrications. We can see the folds or rugae here and also the thickness of the muscles. But in the postmenopausal side, on the right side, we can see that the thinning of the skin, the reduce of the blood supply, and also we can see the color looks pale here, loss of the folds and elasticity. The third condition is urinary incontinence. That is loss of bladder control symptoms that can range from mild leaking to uncontrolled wetting. It caused by the pregnancy, childbirth, especially the vaginal delivery, menopause, cognitive impairment, obesity, advanced age, and women experience this condition twice as often as men. So there are options to treat these conditions. So we can see from the behavioral, there are a large spectrum of treatment options from behavioral, Kegel exercise, but we never know how many times, how long, and what position that can cure this condition. And we can see on the charts also from the non-invasive, minimally invasive to the invasive one here. While behavioral and pharmacological therapies are non-invasive and also safe, but they have limited efficacy. On the other hand, various surgical procedures promise a much better final result at the price of higher associated risk. This is the most popular among the surgical procedures are those performed for a non-invasive or minimally invasive treatment. We can see here in the minimally invasive, we can see tissue remodeling and laser treatment. I use the blue color here. This is what we're going to see how the laser treatment do to help for the this condition for women. This treatment, the CO2 laser treatment, non-ablative thermally processed mucosa, collagen remodeling, and neocollagenesis. I'll show you the video here, how the treatment goes, and I will explain. But sorry if the video goes really slow. I'll try to explain slowly so we can see how the treatment goes. So first, after we clean the vagina, insert the speculum, and then also insert the scope, and we can see here there are lines and numbers on the scope that will help us to do the treatment. And you can see also the 0 number here and the 3 holes around here. 3 holes around here. It is better to us to make the 0 number and the middle hole in one line. So we can treat the vaginal canal start from the anterior wall. Now I will continue the video. So this is what happened inside when we do the treatment. So we can see that when you do the treatment, you have to turn the scope side by side, slowly by slowly, 360 degrees, so we can treat the whole canal nicely and then pull out bit by bit. Remember, when you do the treatment, don't forget to ask the patient, how does it feel? Because the target, it's only warm sensations. when the patient started to feel the warmness, we exactly reach the target. So remember to remember that in the whole canal, the inside area, it's the you can use the higher level because that area is the less sensitive one, and the outer part is the most sensitive one. So when you start the treatment inside, you can use a little bit high, but when you pull out little by little, you have to decrease also the power or the level bit by bit, and keep asking the patients what she feels. Remember that we need her to feel the warm sensation. So when the laser energy pulse delivered to the vaginal canal cause heating of the tissue and also the collagen within. Heating of the collagen causes the its immediate contractions, fibers become shorter and thicker, and consequently the irradiated tissue contracts and shrinks. This is the treatment protocol. As I said previously, that the early position is full inserted. You insert the scope, and then after that we pull bit by bit, and we can use the overlap pulses on the same area or multiple passes here. What happened in here is the shrinkage and collagen remodeling. So heating of the collagen causes of immediate contractions, and fiber becomes shorter and thicker, and consequently the irradiated tissue contract and shrink. And we can see also here the collagen remodeling happens. Now we can see on the picture the treatment zone. What we treat is only the vaginal canal. How many passes? We can use 1, 2, 3 passes here. This is the treatment parameter. The most important one you can see now here is the pulse energy. This is the energy level that we use to treat the patients. We can use higher or lower than this. So like I said before, in the inside of the vaginal wall, we can use higher. Maybe we can start by 90 and then ask the patients if she feels the warmness, we can stop there. But if she doesn't feel anything, increase a little bit. And the stacking time here, we can use 1, 2, 3 passes here. This is the picture right after the treatment with the parameter 30 watts, 90 millijoules, and 3 stacking time. And this is just right target that we want, that we can see the white dots around here and point bleedings. This is just right. And this is the histology for from the control. Immediate after the treatment, we can see the epithelial it's changing here, and after 1 month, we can see the blood vessels getting better, and also the epithelium parts become thicker. And this is the case study that I ran. So a pilot study conducted 15 healthy female sexual active patients who received this LVT treatment from January to June 2015. 3 sessions of treatments, 4 to 6 weeks interval between treatments. Measurement done for the pelvic floor contraction muscle using a perineometer before its sessions with the probe fully inserted into the vaginal canal. This is important. So when we do the measurement, we have to do the measurement in the same place, in the same position, with the same perineometer. And I also have the criteria for the patient candidate here. There are inclusive criteria and also exclusion criteria. The inclusion criteria is a normal cell cytology, or you can ask them to do the pap smear first, and then negative urine culture, vaginal canal, introitus and vestibule free of injuries and bleeding. And for the inclusion criteria, it's pregnancy, injury or active infection in the treatment area, undiagnosed vaginal bleeding, and active menstruations. The picture shows the perineometer that I use. This is the length, 8 centimeters of the probe. And this is the assessment. From the first sessions to the second sessions to the third sessions. We can see the improvement here, which is really good. All of the patients, they experience really good improvement here. Let's say number 1, the first session is 14 millimeter Hg, the second session 17, and the third session is 20. And how long it lasts? I did the 6 months follow-up for each patient. We can see the improvement is still there, though it's not good as the third sessions, but at least the condition is not as the worst as the first time they came, except for we can see the 3 patients that I lined here, they show a really good improvement. The result is still there from the third sessions until the 6 months later. You can see from number 8, number 10, and number 15. And I also did 12 months follow-up. So for the in the 12 months follow-up, we can see the results. Well, it's not getting worse as they come from the first sessions. We still have the tighten here, but in my opinion, they need to be treated at least the 6 months after the last sessions, so they can experience the result and we can maintain the good results after 6 months, in the 6 months after the last sessions. The summary of the assessment. 1 patient achieved more than 40% improvement, 5 patients achieved 35 to 40%, 4 patients achieved 30 to 35%, 5 patients achieved 25 to 30% of improvement, and no patients achieved less than 25% improvement here. And beside that, I also have some questionnaire for the patient themselves and also their partner. Well, I believe when we do treatment to our patients, they want to see the result. They want to feel the result. If we treat the face area, well, we can see the result, but for this, we cannot see. So either we do the measurements or we ask them, how do they feel about this treatment? So they were asked to evaluate the vaginal tightness sessions as 0, no change, 1, mild improvement. 2, moderate improvement. 3, strong improvement. While their sexual partners were asked to assess their sensations of the patient's vaginal tightness with the same grades on the same scale. This is the result. So, mild improvement, one patient's answer for mild improvement, 8 patients for moderate improvements, and 6 for strong improvement. And this is the result of their partners' assessments. 2 persons say it's mild improvement, 6 persons say it's moderate improvement, and 7 persons strong improvement. Question number 2. This question was aimed at determining a patient's assessments of changes in their sexual gratifications after the treatment. There are 5 categories: no improvement, they have more frictions or sensations, better orgasms, more orgasms, or other. An answer under which the patients were asked to give their own descriptions. So this is the answers that I got. 8 patients, or 53% of the patients, they experience more frictions or sensations. 4 patients, or 26%, they experience better orgasms. 2 patients, or 13%, they experience more orgasms. And 1 patient, they experience other. And I give a note here, means that improve of the stress urinary incontinence which she had prior to the treatment. This is the visual analog pain scale. This treatment comfort or discomfort. So I asked them to scale the pain during the treatment. So this is the answer. 73% of patients, they choose number 2, which is means mild or just annoying pain. And 26%, or 3 patients, they choose number 4, which is means it's nagging or uncomfortable, troublesome pain. Well, we can see that the pain is really tolerable here. It's not distressing or, well, some excruciating. It's just discomfort. So what's the conclusion here? The fractional CO2 LVT treatment is an effective and safe method to restore the vaginal rugosity. Thank you. And I open for the questions here.
Thank you, Dr. Tan. And actually, there is someone who raised your hand.
Yeah.
If you have your questions to attendees, so if you have any, do you have any questions for this webinar? So if you have questions, please raise your hand for now. Please raise your hand. And I see Tina last week. They're using email ahmedbar@yahoo.com. Do you have any questions? Question. No, oh, I see. I see. Thank you for your Dr. Tan. Anyway, so
Yeah.
well, actually, in fact, I've got a question for you. And what is usually your patient visit you with which indication then?
Mostly, the indication for this treatment, you mean?
Yes, yes. Like as
Yeah.
they are looking for, like, I want to have my vaginal tightening, or is
Yes.
there some?
Mostly,
Yes.
yeah. Mostly my patients come for the vaginal tightening because, yeah, they maybe have a natural birth delivery, but also they want to maintain themselves or to improve their sexual gratifications. So I experience most of my patients, they come for vaginal tightening. And the uniqueness of this treatment is all of the patients, they experience the increasing of the sensitivity of their vagina. Means that they themselves enjoy the sexual activity more than before. Yeah, which is for their partners, it's also some improvement.
Oh, I see.
Right?
Yeah.
Yes. So all of them, they experience the increasing of the sensitivity. And one of my patients, she's a very young, she's in her 20s, and she's a nullipara, which means have no child yet.
Yeah.
8 years marriage, but she never experienced the vaginal orgasm. As we know, for women, there are clitoral orgasms, vaginal orgasms. So this lady, she never experienced the vaginal orgasm, and her husband, so both of them, they came to me and discussed about this problem. So I asked, so I told them if this, the laser treatment can increase the sensitivity of the vaginal wall. So she tried this LVT.
I see.
So yeah, after the second sessions, they came to me and she said that yes, now she can experience the vaginal orgasm. And the husband is very happy because now the sexual activity is more, well, yeah, it's more excited for them.
I see. Thank you. And now we've got some questions there at the question panel there. And the first question from Miss Dr. Duran, how much time does it take to perform one treatment?
Oh, for one treatment, it's only take, I think, around 10 minutes.
Around 10 minutes.
Yes, around 10 to 15 minutes, that's enough.
I see.
It's really fast, yeah. It's really fast.
So procedure is really fast, you mean? Yes, yes.
Yes. And please tell the patients not to do the intercourse 2 to 3 days after the treatment.
After 2 to 3 days, yes.
Yes. And if they experience some discharge, that's a normal conditions. It will gone by days. 3 or 4 days it will gone.
I see. So you're meaning after the treatment, and there will be we are not recommend 2 to 3 days for do not have intercourse, and also if the patient feels some turbulence with their vagina, and it'll be disappeared after 2 to 3 days.
Yes, they will experience this. There will some discharge, and it will disappear by days.
I see. So, and there is another question from Miss Pedersen, Annie Pedersen. And what if there are cell changing? Yes. So, what if there are cell changes? Dr. Tan.
Sorry. What if there are cell changes? Means that if there are changing cell here, means there are pap smear will show an abnormal result, don't do this treatment. This treatment only for those who have a normal pap smear result. I don't recommend to treat the abnormal pap smear results here. That's why it is very important to do pap smear before we do this treatment. We only treat the healthy vagina.
I see. Only treat the healthy vagina. Yes. Thank you for your comments. And to audience, to attendees, yes. Do you have any questions? And I see someone who raised your hand, Dr. Hind Alhamdan, who is using HUSSSIN699 at yahoo.com. And if you have any question, please send us through the message. Or if you want to participate as your voice, and please activate with your mic or something. If you do not have, I need to tell thank you again to Dr. Tan for your great presentation for today.
Yeah, there is one question here.
Oh yeah, I see. So from Miss Yen, and after the treatment, do you use any medicine for anti-infection?
No, we don't need to use any medications because it's safe. It won't it won't lead to any infection, so we don't need to use any medications.
Oh, I see. So we do not use any medication. The next one, Dr. Lydia Lin. Hi, Dr. Winnie. Can you please show the slide on the treatment parameters again? Thank you.
Okay. The treatment parameter, wait. Sorry.
You take your time, it's alright.
This one?
I think it is right. So, Dr. Lee, I think you've got your answer there from screen. And let's move on to the next one. Oh yes, the other one, Dr. Hind Alhamdan. And regarding loops, what do you think, Dr. Tan?
Yeah.
Yeah, regarding loops.
Regarding looks?
Yes, regarding loops. He mentioned that just regarding loops. Or maybe perhaps Dr. Alhamdan, please explain your questions first, please. And during we waiting for Dr. Alhamdan, and there is another question from Miss Annie Patterson, Dr. Annie Patterson. And if you had cell change, and have you been cured of this with the treatment, then be okay?
If you have some infections and it's already cured, then you can do the treatment.
What does that mean, Dr. Tan?
Well, yeah, if you found the patient she has infections in the vaginal area,
yes.
So better to treat your patients, and after she's been cured, then we can do this LVT.
Oh, I see.
But you make sure that she's cured.
Okay. So after there is some infections or some there, I mean not infection but cell change. So if you have cell change, which means there is some malfunctions or something weird or including
yes,
there.
yes, I read this. Not infection but cell change.
Yes.
If you have a cell change here,
Mm-hmm.
you better have a further consultations, and then make sure that the what kind of the cell change here. But my opinion, I suggest not to do this treatment in any changes of the cell.
Ah, I see. So we
Just in the
okay. So
normal pap
normal
smear.
pap smear. Yes, exactly, Dr. Alhamdan as well. So only this treatment is for only normal pap smears. And let's move on to, I think he's from Vietnam. And how old your patient? The oldest and the youngest and average age?
Yes. The youngest is the I have the youngest patients 18 years.
18 years.
Yes, 18 years old lady. I mean, and then the eldest is 62, I guess.
62. An average perhaps
Yes.
something in the middle, isn't it? Is it?
Yes.
So
Yeah. The most, yeah,
most
between
of
them,
them
like 30
are,
or
yeah,
40s. Yeah.
yeah, end of 20s
So
to early 30s.
yes, the most important one when you treat the menopause lady is we have to be extra careful because of the dryness of the vagina. This vagina is very sensitive.
Yes.
We need more lubricants in the vaginal wall, otherwise it will bleed easily. So when you treat the menopause or postmenopausal women
Mm-hmm.
with dryness vagina,
Yes.
the thing that we have to do is lubricate the vaginal canal first.
Mm-hmm.
You can use lidocaine gel, which is can help them
Mm-hmm.
the anesthesia the vagina canal, help them to reduce the pain because it might be painful for them.
I see.
Yeah, you can use the lidocaine gel or just a normal gel to lubricate the area, or you can spray with the saline before the treatment,
Uh-huh.
and then use more gels
Okay. So
when
in
you insert the scope or the speculum.
I see. So I think it is also the right answer for Dr. Annie Patterson. And there is another question from the bottom. And as I know that from Dr. Yen, Nguyen Yen, and as I know that when you treat near the outer, it will be more pain than inside, right? So do we need more fluence when treating near outer?
Yeah, we can see here on the chart
Uh-huh.
the pulse energy is 90.
Yes.
So when we start the treatment, we start from the inside part.
Uh-huh. Yes.
We can start by 90 millijoule here and ask the patient, does he feel the warmness? If it's not, you can increase this energy. And then as we move to the outside part, we decrease the level. So maybe in the outer side, it's only 5 to 10 millijoule that they can stand. So it's a different, really a huge difference from the inside to the outside area.
I see. Thank you. And I think that will be the last question for today. And Dr. Sipka Zaiwal. And how do you clean the vagina probe after treatment?
How do we clean?
Yeah, how do you clean a vagina? The last one.
Oh, you have to sterilize the probe, wash it, and then sterilize it into the autoclave.
Okay, so we need to apply that. So
Yes.
yeah, thank you. I think so. I think we're quite done well so far today. And thank you, Dr. Tan, for your great presentation and share with us among globally and with your wonderful cases. And thank you for your participants to all attendees. The recorded video will be shared within 2 weeks through Jeisys website. Next Jeisys monthly webinar will be on the second week of January next year. It's too surprised that it's the last month for this year. So the detailed information will be sent through your email. So thanks again, and to everyone, Merry Christmas. I think and all the questions we've got today, I'm going to email you everyone. So thank you everyone. So you're free to go now. Thank you. Thanks, Dr. Tan.
Thank you, Yumi. You're welcome.
Thank you very much.
So we're done? Oh, okay. We're done. Okay.